This week, Dr. Charles Vilfort will continue to talk about good mastication. Why? As we mentioned before, mastication is the first step of digestion. And if we are going to talk or to continue talking about good mastication, we have to talk about pH. What is pH? pH stands for potential hydrogen. It was discovered by Sorensen in 1909. By the time, Sorensen was working in a beer company. And for me, pH is the measurement of chemical activities of the hydrogen ion. I'm going to repeat, is the control of activities, of chemical activities of hydrogen ion. Why it's important to talk about pH? It's because it will vary from the mouth to the rectum in the digestive system. For example, in the mouth, the pH is between 6.8 to 7.2. In the esophagus, is no less than 4, between 6.5 to 4. In the stomach, is less than 5, but no less than 0. When we are eating, we have to control, to make sure about what we are eating. Why? It's because if we eat too much acid food, that could be a problem. If we eat too much alkaline nutrient, that could be another problem. That means we have to select and we have to control what we are eating when we are masticating, or if we want to live healthy and for a long period of time. What is the esophagus? The esophagus is the part of the digestive system who connect the mouth to the stomach. The esophagus has two sphincters, one on the top and the other one at the end. How come the food after we swallow goes to the stomach? There is something called peristalsis. What is that? There are some peristaltic movement that facilitate contraction and relaxation. When the peristalsis contract, that will send the food to the stomach. But we have to talk about the importance of the inferior sphincter that has to close the respiratory system to avoid the food to go there. Because if food goes down to the respiratory tract, that can cause some problem, such as reflux acid, dysphagia, esophagitis, and esophageal cancer. How to avoid that? Like we said before, if you masticate well, your food, you will have less problem, and you will not have dental problem, or you will have less. You will have good oral hygiene, and also you will decrease the possibility of dysphagia, esophagitis, and and esophageal cancer. Maybe you heard about protein for people who have cancer. You can also have people telling you, even you have cancer, you can eat meat, but in small proportion. When they first discover protein, they use that with meat as two synonyms because they didn't know better. But with time, they realize there are two types of protein: animal and vegetable. That means animal, all sources are meat. Vegetable sources are plants or vegetable. That means, from my experience, I will tell you, if you have been diagnosed with cancer, I will suggest you to stay away from meat or from animal protein. Why? It's because at the beginning they didn't know better. They suggest people to eat animal protein or meat because they know we cannot survive without protein. But now we know about vegetable, other source of protein. It's better when you have been diagnosed with cancer to stay out of animal protein for at least 4 to 6 months. This is what I suggest. But if you have been diagnosed with cancer and you want to go natural, we can help you. But you don't have to come to my office to do so. We can do it with long distance. The only thing I will suggest you, even doctors or health professionals cannot help you if you don't want to help yourself. That means for us to be able to help you, you are supposed to be able to go and to follow our recommendation. But there is another thing I'm going to tell you. If you're talking about nutrition, or you want to prevent certain disorders, even cancer, or you have been already diagnosed with cancer, one of the best professionals you can contact is a naturopath. But it will be even better if that naturopath has a pass as a conventional medical doctor and also in sport medicine. That means it will be better. For his experience, he can help you with your nutrition, how to prevent some disorders, and how to manage or some of the disorders. But what I'm going to tell you before I go cancer doesn't necessarily mean end of life. You can survive for years, depend of how you manage yourself after being diagnosed with carcinoma or cancer. It's all for this week. I hope you are going to follow me and call me if you are in need of prevention or you want to go natural with whatever disorders you have. Thank you. Next time. My phone is there, 516-830-7371.